In this presentation, we are talking about triage, and in particular, the National Health Service NHS England 10-second triage tool, which has been designed for first responders, including fire service and police, to use. Triage is a dynamic process. As the casualty's condition progresses, so their need for intervention alters, and the triage category may change to reflect this change following retriage. To reflect this process, triage must be repeated regularly. Remember, it is only a snapshot of the casualty's condition at that moment in time when triage is being performed. Triage must be simple, fast, reliable, and most importantly, reproducible. Triage tools are a key component of clinical risk management in the highly stressed emergency care environment. In a disaster, two types of triage are necessary. We will be talking about primary triage, which occurs at the disaster scene, for example in a train carriage or a multiple vehicle collision. It needs to be fast, reliable, reproducible, easy to use, and easy to teach. In a major incident or disaster, once a triage priority has been assigned, the casualty is labelled appropriately to prevent duplication of effort and confusion among other rescuers. The key to a successful labelling system is that everyone involved in the response understands the system being used. Labels should be easy to use, clearly visible, resilient in wet environments, easy to attach to the patient, accessible for clinical record keeping. In this slide, we'll look at three different versions of triage labels. They all have a unique identifying number, and labels must allow for the casualty condition to improve or deteriorate. On the left hand side is the cruciform system, which has a barcode as a unique identifying number, similar to on the right hand side the smart card system. In the center is a wristband system utilizing a unique identifying number of a barcode or QR code. Triage Civ primary triage is the first initial categorization of the casualty. It's performed at the point of contact and designed to sort each casualty into priority status. This type of triage is broken down into four. In this video, we'll be looking at 5 distinct categories. These categories are outlined in the following slides. Triage category priority 1 immediate. Casualties who require immediate life-saving interventions, advanced life support and or primary surgery within 2 hours. Triage category priority 2 urgent. Casualties who require surgical or other interventions within 2 to 4 hours. Triage category priority 3 delayed. Casualties whose treatment may be safely delayed for beyond 4 hours. These would be your walking but injured patients, priority 3. Do not identify uninjured survivors as priority 3 patients. Triage category not breathing, as per the NHS 10-second triage tool. Following the casualty's airway being opened and replaced in the recovery position, CPR must only be performed on these casualties only if resources allow. And triage category dead. Casualties are not breathing. Following clinical interventions, medical professionals can categorize these casualties as dead and labeled appropriately. This 10-second triage tool shows that recommended priorities triage routes depending on the incident characteristics. Each has a yes, which guides you to the next question, or a no answer, which determines priority, P1, P2, and P3, or not breathing, dead. Clinical instructions are written in bold lettering. For example, walking, yes. This categorizes the patient as priority 3, green. Severe bleeding, yes. Utilize a pressure bandage tourniquet where appropriate. Categorize the patient as priority 1, P1, red. Is the patient talking? Yes. Check if there's penetrating trauma on front and back on the torso. If there is, yes. To that answer, the patient is categorized as priority 1, P1. If no penetrating trauma, the patient is categorized P2, yellow. If the patient is breathing, open the airway if able, place in recovery position. Again, Ask the question, is the patient breathing? Yes, the patient is now a priority 1, P1, red category. If the patient is still not breathing following this intervention, CPR can be performed if and only when resources allow. The 10-second triage tool is broken further down in the following slides. Is the casualty walking? Yes. Have they got injuries? Yes. The patient is categorized delayed, priority 3, green. Uninjured casualties should be corralled in the survivor reception center or a designated space. Is the casualty walking? No. Is the casualty bleeding? Yes. Apply a tourniquet and/or hemostatic dressing where appropriate. This casualty would be categorized as immediate priority 1, red. Is the casualty bleeding? No. Is the casualty talking? Yes. Is there any penetrating trauma on the torso, front or back? If there is yes to that answer, the patient is categorized as immediate priority 1, red. If no to that, no penetrating trauma, front or back on the torso, the casualty is categorized as urgent priority 2, yellow. Is the casualty talking? No. Are they breathing? If they are breathing, open the airway. Yes. Place them in a recovery position. Still breathing? Yes. This patient is categorized as immediate priority 1. If they're still not breathing, following opening the airway, place in recovery position, CPR can only be performed if resources allow. Following slides we'll do a little test to see how we are progressing. Casualty 1 is a 26-year-old male patient who's walking with a fracture to his right arm. What is this patient's triage category? Yes, this patient is priority 3, delayed, P3, green. Casualty 2, an 18-year-old female patient trapped by debris has a penetrating abdominal wound. What is her triage category? Correct. Her triage category is immediate priority 1, red. Casualty 3, 32-year-old female patient trapped, unable to walk, with a head injury, but is talking. What is her triage category? Correct. Triage category is urgent, priority 2, P2, yellow. The 10-second triage tool utilizes an AMR with a tally card on the back of it. These tally cards can count up to 20 patients in each category of priority 1, priority 2, priority 3 and not breathing. Also on this AMR is the methane message. The methane message is utilized to declare a major emergency. It's broken into 7 distinct areas. M for major incident, E for exact location, T for type of incident, H for hazards, A for access, N for number of casualties, and E for emergency services. Thank you for taking the time to view this video.